Welcome to another show of Healthcare Business Growth Conversations. Today, we are joined by Dr. Mazza, a triple board certified integrative endocrinologist and founder of the Metabolic Centre for Wellness in Florida. She has successfully bridged the gap between the functional and traditional medicine with a unique hybrid practice model. She is an author, a teacher to other clinicians, and a leader in metabolic health. We are going to explore how she built a practice that prioritizes patient outcomes while remaining a profitable, sustainable business. Dr. Mazza, pleasure to have you.
Oh, thank you so much for having me. I appreciate it.
Dr. Mazza, I just want to start with the why. At what point, you decided to leave the standard care and then found the Metabolic Center for Wellness? What was the specific breaking point or a gap that you saw in the industry that made you say, I have to build this myself?
Definitely, definitely. So it was kind of a series of events, really. When I finished fellowship, I joined a hospital-based practice, and I was the only physician in the practice that did thyroid ultrasounds and thyroid ultrasound guided biopsies. So I naturally got a lot of the thyroid patients. And I realized with taking care of patients over time, we were missing a lot of patients who had serious thyroid issues going on. We were undertreating, we were misrecognizing symptoms. And the thyroid, as your listeners might know, really affects every single system of our body. There's not one system that isn't affected by thyroid. So when the thyroid is off, it can cause really big symptoms that may seem big to the patient, which they are, but they go under the radar from the traditional kind of endocrinology scope. So as I started studying more and more about thyroid, I kind of went more and more into the integrative field. So integrative medicine is really a combination of traditional medicine as well as more functional. So more functional medicine is more can be a little more labor intensive on the patient side, but it really focuses on diet, lifestyle, sleep, stress, all those good things, and a lot of the good things with traditional. So then when we opened our practice, and this past summer was 10 years now, which is hard to believe, that was kind of our goal, is to bridge that gap that you're talking about between really looking at the patient as a whole, not just from a thyroid standpoint, but a hormone standpoint in general, and all the associated metabolic dysfunction that can go along with hormone imbalance, and really working towards a teamwork approach to better patient outcomes. So that's kind of why Metabolic Center for Wellness, our clinic, came to be.
Awesome. That's a good purpose to have. So, I just want to mention a little bit more on the hybrid model because it is rare to hear about the hybrid models. So, it is a membership fee while you still accept insurance, correct?
Yeah, that's correct.
Okay. So for the providers listening, who are scared to leave the traditional model but can't go fully concierge. Now, why was this the right structure for you? And then how does it balance business margins with patient accessibility?
Right. And you make a big point. Starting out on your own can be really, really scary because as doctors, we're not really trained in business as much as we probably should be. I mean, I always thought that I would work for an institution and never thought I would start my own practice. So it can be scary. So sometimes, you know, small steps go make big changes. So when we opened up the practice, I knew that I wanted to have enough time to work with my patients. And in purely integrative and functional healthcare practices, a lot of them are cash. So I I knew that a lot of our patients that we were already taking care of, because we transitioned to this hybrid model about a year to 2 years into our practice already being in existence. I didn't want to feel like our patients were kind of being tossed aside if they couldn't afford to pay completely cash. So I was talking with a colleague of mine, and he had started in his practice out in the Midwest this type of hybrid model, which kind of seemed to be the best of both worlds. We could manage our patient load. I could have the time that I needed with my patients, because when you're purely working off of an insurance-based model, you have to see X amount of patients every day in order to just kind of make ends meet. And that leads to some of the, I think, physician burnout. I think it leads to a lot of patient frustration where they feel like, oh, my doctor's not even listening to me because they only have like 10 minutes with me. So it's like frustration on both ends. So in order to me to be able to have time with my patients, we instituted this hybrid model. So where we still, yes, do bill insurance, but we have a yearly fee. So it's right around $200 a year. And when we looked at the numbers in order to say, I only want to see 15 to 20 patients a day, this covered the cost of not having to overload the schedule because we never double book. I do my own ultrasounds here in the office. We have some other services that we can talk about later, but the hybrid model for us was really the best of both worlds in order for our patients to still be able to come to the clinic who couldn't pay just cash, and for us to deliver the care that we wanted to.
Got it. So I just want to talk about the technology differentiator. Like you're the only clinic in Central Florida offering the radio frequency ablation, the RFA for thyroid nodules. Now, from a
That's
business
correct.
growth perspective, from a business growth perspective, how important it has been to invest in that specific technology to differentiate yourself from others in the market?
That's a great question because it is an investment. So what if say any provider is working to bring in a new technology, you have to pay for the equipment, and that has to be factored into your budget. One of the things that I always found frustrating taking care of patients after thyroid surgery is we have to replace that thyroid for we have to replace it with medicine. But there's a lot of people out there that have thyroid surgery that didn't necessarily have to have thyroid surgery. So RFA is a great non-surgical way of actually treating the nodule, because when you send someone for thyroid surgery who doesn't need thyroid surgery, you really haven't corrected the problem. You've just taken the thyroid out and you've caused another problem. So that's kind of when patients are seeking out therapies, this is a very patient driven procedure. Patients are looking for options. So we wanted to be able to provide a way for patients to get this here in Central Florida, because otherwise, when we started doing RFA, so a radio frequency ablation, it wasn't FDA approved here in the States until 2019. It was approved all over the world for the most part, but here in the States was 2019. And then we started doing it early part of 2020. So yes, we made the investment in the equipment, but it quickly paid for itself because patients were seeking out this procedure and we were able to deliver it. So it really has been a nice added benefit, I think, to our patients. It's brought in patients who are really proactive about their health too, because they don't want to just have surgery as an option. They're looking for other things. And that also will tie in like lifestyle things. They want to do things that actually will help them uh, improve the resilience and longevity. So these are very proactive patients that are seeking out this procedure.
Awesome. So I just want to touch base on that part where you said it is a right investment for you. And also, like you said, you are never trained to run a business. And I just want to add one more point. I believe you were never trained to run the teams, right? Like the medical teams and the non-medical teams where
Right.
you are in the college. So as a business owner, you have to wear many different hats. Like on one hand, you have to manage vendors, make financial decisions, and on the other
Right.
hand, you have to make the operational decisions on a day to day with both the medical and non-medical teams. And whenever you bring in these new technologies, you have to make sure that the patients are aware of the technology that you have
Exactly.
at your clinic. So that's patient education slash marketing slash advertising. So like you're wearing many hats. So how could you juggle between these departments, and then what is the lesson that you learned?
Oh, that's a great question because yes, as doctors, we kind of are a little bit of we get that team leader training a little bit, like when you're in the hospital, when you're covering the floor or whatever, you're kind of in charge of that team at that time. But when it comes to an actual business model, it's another ball game altogether. So I went from just worrying about labs and patient care to looking at the bank account and paying bills and doing payroll and managing personalities. So I was lucky because my husband is the office manager, so we kind of share some of that responsibility. Um, so I'm a little, I'm blessed on that end. But anything for just even paying rent and dealing with just we have a billing service, so we have to manage that. So it's can seem very overwhelming at first, but it actually becomes part of a new routine. And we're lucky because we have really great staff, but we also keep the overhead as low as we can too. So if you can kind of keep things to a manageable load, but it is kind of like if you keep it to a dull roar and it's a manageable roar, it's easier to handle. I find that when I talk to other providers, when they're dealing with lots of employees and lots of overhead, the stress is a lot more on them. So I talk to my patients about stress every day, and I also like to keep my stress level at a certain level. So I do one of the ways of doing that is by keeping kind of things low. So we have low overhead. I only have we have two medical assistants. We have a billing service. We have my husband who's the office manager. So we kind of keep things to a kind of a small scale. People will ask me all the time, well, why don't you just hire a PA or hire a nurse practitioner? That's really not something I'm interested in because I still know that my patients are going to want to see me, and I don't know that that's going to change things. So, my advice to docs just starting out with their own practice is keep things small and manageable.
Awesome. And focus on the patient care, right? Like, as you said.
Right. And when you
So,
add things in like the RFA, we only do one new thing at a time. So if you add in a lot of different things all at once, that also becomes less manageable. So one small change a year, I think, is a good philosophy, or at least the one that we've used.
got it, got it. So, and while I was going through your offerings, I read about the IV drips. That was interesting to see. Like, do you find that patients typically come in for a serious thyroid problems and then discover these wellness services, or do these treatments attract completely different, more proactive demographic to your clinic?
I think from our standpoint, when we started the practice, I always had ancillaries in regards to supplements because I do consulting for a supplement company. So my patients were always kind of used to that nutraceutical aspect of things. But as new patients are coming in, they kind of find that, oh, IV, I didn't know you had that. This is something I'm interested in. How can this benefit me? How can we work this into our visit? Because lots of times now I'll have a regular routine patient visit. We'll start the IV, we start talking, and it's just an added draw to our patients. Our patients feel like they're lucky they can come in, they have a visit, they're seeing the doctor, they're getting their IV at the same time, they're getting their supplements. So we try and make it as I don't want to say one-stop shop, but we try and give as many benefits to our patients from a healthcare standpoint. Yes, those aren't covered by insurance, but
Yeah.
I think people don't mind when they feel like they're getting something out of it. And I really feel like the IV drips do add that extra benefit.
Yeah, that's a smart move. Like, what was the trigger for you to add the IV services?
Right. So I kind of was, again, always in that integrative mindset. I was looking for something to add uh, to our services, and IV drip seemed like a natural thing. I mean, who can't benefit from some IV glutathione to boost their immune support? Or I take care of a lot of women who have low iron, so we do the IV iron infusions because when you think about it, iron is very important for our thyroid function. So if you don't have enough iron, your thyroid's not working right. If you don't have the right antioxidant balance, your thyroid's not going to work right. So, and we do have some patients that come in who are recovering from cancer. So these high dose vitamin C drips are really essential to their overall care plan.
Got it, got it. Yeah, see, even I was surprised when my partner in Palm Beach, one day he was getting the IV drip and then he hopped on a call. And I looked at that IV, the drip, and then I was like, What is this? Like, are you sick? I mean, you're like, no, no, no. It's just a concierge IV services where they're coming to his home and then providing the service. And then I was like, wow, that's a
Yeah.
That's a good business model.
Yeah, and we'll have patients where they're going to be going away on vacation, so they want to boost their immune system before they leave, so they don't get sick while they're traveling, or they just came back from vacation, or they're getting over a virus or a cold, or it's a great way of really boosting the immune system.
Yeah, wonders of modern medicine. So I just want to go into the clinical philosophy side. So you have famously said there is no magic pill in endocrinology. So in your experience, what are the three most overlooked lifestyle levers that meaningfully change thyroid health before medication even enters the picture?
That's a great question because yes, I wish there was a magic pill. I mean, wouldn't that be nice? But
Yeah,
probably
definitely.
I mean, wouldn't it be nice? But if I had to pick three, I mean, nutrition is probably the top of it. So if you don't have the right nutrition, you're not getting the right micronutrients that your body needs and that your thyroid needs to work its optimally best. Your hormones aren't going to be balanced. Nutrition is really at the core of everything. I always People will ask me about different trends in diets over time. Well, some people do better with different types of diets. Really, you can't go wrong with a Mediterranean or an anti-inflammatory diet, and that's probably best for the thyroid. I mentioned stress. Stress is a huge one. If we don't have our stress under control, stress is our cortisol. So cortisol is our stress hormone. So if our cortisol is off and our balance between our pituitary and our adrenals are off, it makes it tough to balance the thyroid. So I could probably say if you don't address stress and the cortisol response, you're going to have a hard time dealing with any other hormones because cortisol is our main hormone. We need that one to live. So that would be two. And then probably the last one is sleep. Sleep is so important. It's when we restore and regenerate and regroup and clear out all the bad stuff from the day ahead and get started for the next day. So probably nutrition, stress, and sleep. If I had to say a fourth one, it'd be exercise, but I only get three.
Well, without these three, exercise no is no good for the body.
Right.
I'm really glad to hear that. Me, being from the non-medical sector, just hearing, to put them in a very simple terms, like get the right nutrition, keep your stress at check, and get the right sleep. I think you're covering the most of the basics, right?
Yeah,
And
if you
then
can get those under control, yeah.
add exercise to on top of it. So it sounds simple, but yet, yeah, hearing from the doctor, put it in a structure is always helpful.
And making it part of your routine. I think that's the key thing for folks and taking care of patients over time. If it's part of your routine, it's pretty much automatic, so you don't even have to think about it. So,
Yeah, most of the times what I have seen is it is always a bell curve. If something goes wrong, then
mm,
people start looking into it very well, and then they get well, and then they go down again because they feel very good, and then the habit
right.
goes on.
Yeah, you're exactly
Yeah, but
right.
yeah, you're right. Like, to make that as a habit so that, it is not a bell curve. So, like, on the same side, like, we can't talk about metabolic health without talking about the Ozempic and Wegovy. Like, you have used this for years for diabetes, but now everyone wants them for weight loss. How do you manage the patient's expectations of a quick fix against your philosophy of long-term wellness?
This is a you know what this is something that I this is a conversation I have more frequently than you would think. So yes, I've been using. So the first GLP-1 agonist came out back when I was in fellowship, so it was a while ago. But and these generations have changed over time. So I feel very comfortable using these medicines, and we knew that they would help with weight loss because we saw the benefits from our diabetes patients. Now, the trick is, again, not getting into this magic pill, magic bullet sort of thought process because patients will come in and say, I really want to lose weight. And I think they're great tools in our toolbox, but they also aren't going to work on their own. So we have to address nutrition as well. So we see a lot of muscle loss with folks, you're going to lose some muscle when you lose a lot of weight. That is what it is. But you want to be able to maintain lean muscle. So addressing the protein status, um, you know, we'll have issues with GI issues like constipation. So staying on top of that. A lot of, especially women, will experience hair loss if they lose a significant amount of weight. So staying on top of that. But I think what has come up, and I've realized is, one of the benefits of these medicines is it helps manage appetite. But we also have to address the fact that hunger is a hormone. It's a normal response. It is okay to be hungry. These medicines should not shut off your hunger for the rest of your life, because these hormones are mediated by ghrelin and growth hormone, and these are important hormone balances. And this is kind of a common complaint I'm getting now is like, oh, the hunger's coming back. Well, you want to feel a little hungry. You don't want to feel like you're forcing yourself to eat. So this is the balance. I've been calling it my love-hate relationship with GLP-1s, because they are great tools, but they have to be used in context. Otherwise, we have more GLP-1 combinations coming down the pipeline, and they're going to be stronger and stronger. But if we don't address these concerns now, it's going to be problematic later.
Well, got it. So I think that's a good piece of advice over there on the GLP ones. So I quickly want to jump onto something that you have done in 2023. You wrote a book, Thyroid Talk, and you published that book in Amazon, right?
That's correct.
Okay, how has becoming an author changed the way patients perceive you? Did you see a shift in the type of patients finding your practice after the book came out, or is it more of a reputation management kind of a exercise
It's
for you?
it's kind of a combination. Writing a book was always something that I wanted to do, but it was always on the back burner. So when COVID hit, I had a little more time, so I just started writing one chapter at a time, and
Mhm.
then it kind of came together. Um, as far as so I have a lot of long-standing patients, so they just love the idea that I wrote a book, and I think that's awesome. But we have had a new kind of uh, different type of patient who are seeking out more integrative endocrinology standpoint, because there aren't many integrative endocrinologists out there. So people are searching for different answers and different kind of treatment options. So these are the folks that are being drawn by the book. So I mean, I've been nothing but so happy with doing the book. Would I do another one? I'm not sure. It's a lot of work, but
Yeah, yeah.
but it's been a great experience. So thank you for asking.
Got it, got it. No, I was reading the reviews on Amazon, so like the reviews were really good. That's why I was a little bit more interested to know whether you are able to tap into like a new market after now people reading your book and then now dialing your office for your appointment, or is it
Right? Yeah.
more? That's one angle. Other angle is your existing patient should be feeling proud of you, right?
Yeah.
Looking at the
It
book, so.
it's
Uh,
been nice. We'll have new patients that come in with the book, and they'll want me to sign it, and then my existing patients come in. It's kind of heartwarming. So I appreciate the support.
Awesome. Congratulations, by the way, for your
Thank you
book.
so much.
Yeah, I hope more books coming in the future then.
We'll see.
Well, they always say that first one is the hardest one, and then the rest of them will flow.
Right.
So yeah, yeah. So
We'll see.
I just want to jump on to. Yeah, definitely. So if you could wave a magic wand and redesign the way the average patient is diagnosed and managed for thyroid disorders in the US, what is the one thing that you would change immediately?
Wow, that's a pretty big question. I think probably the biggest thing I would change is just relying upon a single lab test. So TSH is kind of like the standard of care for screening, and that stands for thyroid stimulating hormone. It's actually an indirect hormone. It comes from the pituitary, so it sometimes misses a lot of subtle thyroid issues. So I would say maybe a more expanded thyroid panel including circulating levels like free T4, free T3, thyroid antibodies, because there's a lot of undiagnosed autoimmune thyroid disease out there, and the antibodies help kind of find those folks, and listening to symptoms. So I think it's always a great idea to take a good system intake, no matter what we're looking at, whether it's hormones or cardiac or GI. A good I'm a fan of a good log of symptoms, because you don't know where you're starting out at. Even if we make changes in treatment, I want to know, okay, are you still feeling tired? How's your sleep? Um, what's going on with your skin and hair? How's your gut? Any chest pain, heart racing, like those sort of things. Taking a look at the whole person in a more expanded thyroid panel would help us kind of uncover a lot of folks that may be suffering from thyroid issues, but their TSH is always just technically normal.
Wow, that's eye-opening. So, how could a patient navigate these issues then?
That's a great question too. So I'm a huge fan of, I'm a patient advocate. So talking to your doctor, you know, going in with the list of concerns to your visit, just trying to be proactive about your health. And if you feel like you're not getting the answers you need from one provider, there's no harm in seeking a second opinion. It's okay.
Got it. So, you provide training sessions for other clinicians, right?
Hmm.
So, where can these clinicians learn more about your training programs? Do you have any schedule that is published, or how does it work for you?
Sure. I do a lot of teaching mainly through an organization called A4M. Um, it's a society for anti-aging and regenerative medicine. So I teach with the fellowship modules there. So I teach thyroid and adrenal. So um, those are programs that are available to any clinician. They can sign up for symposiums or conferences. They can even do online learning. As far as patients, I do have online master classes. So to really help kind of dig into thyroid and all the things that thyroid affects, how to talk to your doctor, what are the tests that you need. We talk about stress, sleep, nutrition, gut health, a lot of gut health. And that's available online too. And I have a podcast, so we talk about thyroid issues and concerns and those sort of things. So I feel like there's a couple different avenues out there that folks can kind of learn more information.
So, what is the podcast name?
It's called Thyroid Talk with Dr. Angela Mazza.
Yeah, whoever is listening, please go and subscribe.
Appropriately.
Definitely. Yeah, definitely. Where can patients find your book, The Thyroid Talk? Then,
Sure. The book's available on Amazon. So it's Thyroid Talk, an integrative endocrinologist guide to optimal thyroid health.
awesome. And also, they can subscribe to your podcast.
Of course, of course.
Yeah, perfect. So, before I let you go, Dr. Mazza, I just want to ask you one final question. The new kid in the block, AI. So, how do you perceive AI now? Is it disrupting, or is it helping you, or how do you see it?
You know, I try and I I've been trying to use AI on a just a regular best basis, test it out. I think we have to embrace it. I think it's here, so we should be able to use it to its ultimate. I think it's going to be helpful for not only physicians but patients. I think the concern from a provider standpoint is that will we be replaced somehow by AI? I'm not. I don't think so, because I think that would be kind of tough to do. But I think we have to utilize it to our advantage. That's for sure.
Well, that's uh, that's how it should be, right? We should be embracing the
Ideally,
change.
I don't think
Got
AI
it.
is going to be able to do RFA anytime soon. So I'm
Well, AI is not going to make a decision that you accumulated your years of experience, right? And there is no way it just helps you to now maybe to read 200-page history document of a patient easily.
right. I think it really adds to time efficiency. So
Yeah, yeah.
anything, yeah.
Got it. Thank you for your wonderful talk, Dr. Mazza. Thank you for your time
Oh,
today.
oh, thank you so much. And thanks for having this platform for providers to get more information about running their own business. And it can be pretty, I do have to admit, it can be pretty daunting in the beginning, but it's really well worth it. And when I talk about stress, it's a good stress.
Got it, got it. Yeah, see, our goal is to bring in professionals like you, talk about the business side and the leadership side of what you're dealing with, because now we felt, that's where a lot of them are struggling with,
Yeah.
with the vendors, with the internal teams, and a lot of maybe 100 different things to do along with taking care of the patients, because at the end of the day, care should be at the core, and then everything should revolve around it. But whenever you're running a business, running the business will become the core, and then the rest becomes the
Right.
layers on top of it. So that's why experienced professionals like you should be talking more about it, and we really appreciate your talk and the time today, Dr. Mazza.
Oh, well, I so appreciate it. Thank you so much, Rakesh.
Yeah, thank you.